From the most trusted names in local news, KDPG Sunday Edition.
This morning on the KDPG Sunday Edition, this weekend marks 50 years since America set foot on the moon. We're going to talk with the chief executive of a Pittsburgh company that's helping NASA get back there. But first, putting a spotlight on better approaches to treating kidney disease and the larger issue of organ transplantation. Good morning, I'm Ken Rice. Across America this morning, more than 113,000 people are waiting for an organ transplant, and that's a mere fraction of the 37 million adults in this country with kidney disease. This month, President Trump signed an executive order that aims to transform kidney care and improve patients' access to transplants. Our two guests know all about this. Dr. Naktai is a nationally recognized transplant surgeon and chair of the Department of Surgery for Allegheny Health Network, and Susan Stewart is CEO and President and CEO of CORE, the Center for Organ Recovery and Education. Welcome to you both. Thanks for coming on.
Thank you.
What is the biggest challenge in treating a patient with kidney disease? Dr. Ty, let's start with you.
Well, it's all the other comorbidities that come along with the kidneys. When you have kidney failure, you have a higher rate of developing cardiovascular diseases. You have a higher rate of developing infections. You have a higher rate of all sorts of other diseases. And so that's one of the challenges. And the biggest challenge to help these patients is, in 2019, today, the best approach to treating people with kidney disease is probably transplantation. And so getting them to transplant, I think would be something that would be very helpful for the patients.
Okay, so the president, with this new initiative to make getting transplants easier, right? Increasing patients' access to transplants. What do you think? What is the plan, and what do you think of it, Susan?
Well, we're very excited about the executive order. We do believe that it's going to increase the number of transplants. We think that it's going to remove some of the disincentives to take some of the more complex donor cases that we're faced with. As Dr. Tai was saying, we have a population that has a lot of comorbidities, and so when we are recovering those organs, oftentimes they are more complex. And so for the procurement organizations, it's go and recover a single organ, because that impacts our performance metrics with CMS. And then on the flip side, asking the transplant centers to use some of these complex organs, that affects their outcomes. And so there's this disincentive to do that. And so with these executive orders, I think we will see that we will remove some of those barriers.
There's a particular focus, isn't there, in the executive order on promoting living donation. Can you explain what that is and why there aren't more living donors now?
So the living donor, that's really increased in number over the last 20 years. Living donation, especially in kidney transplants, account for about 30 to 40%. It's been increasing every year. Nonetheless, we still have some issues like donors who are working and can't take time off to go to work. Simple little things like transportation costs. And so I think this executive order will help out financially and will allow a certain number of people who would want to donate their kidneys. So we applaud it.
So kidney donation can come either from a living donor or a deceased donor, but most of them still are from deceased donors, is that right?
Yes, 60% of them, yes.
How do we get more people, Susan, to be willing to be an organ donor? What's the biggest barrier?
I think we continue to have to work on the misconceptions that have existed for years, that the healthcare team will not try to save my life if I'm in an accident and I'm a registered donor, which is the number one misconception, because the treating team when you're in an accident is completely different than the team that is treating the patient for transplant. So if we could break down some of those barriers, and if we could encourage everyone to register to be a donor, folks will say I'm too old or I have too many illnesses. And that is not the case. You're never too old to register to be an organ donor. There's no upper age limit. And at the time of death, allow the transplant surgeons to decide what organs are suitable for transplant.
The executive order does address that right by raising the possibility of new metrics for OPOs so that they're not penalized for exploring the possibility of taking an organ from an older person or a very sick person.
That is correct, yes.
And how would that work?
They will come up with new metrics. Right now, one of the metrics that we're measured on is how many organs are recovered for transplant from a single donor. So that if there are a lot of comorbidities and you be able to recover the heart or the lungs, but you still could recover the kidneys, this will remove some of those barriers if we can remove measuring us against how many organs are recovered. And then it should help.
It should help us as well. It's been a good partnership with CORE and with Susan. So we very much appreciate what she and her organization is doing to maximize recovery of organs.
Kidney transplant will always be preferable, generally speaking, than a patient being put on dialysis, correct?
Absolutely.
Okay.
Absolutely.
There's been some reporting about the way the business works in the wake of the president's executive order. Some critics will say that some doctors who are also have a business relationship with a dialysis clinic have a financial incentive to keep a patient there within their network, getting dialysis services there. Is that in fact something that happens, and how do you, if that's true, how do you break that incentive?
I think that does happen to a small extent. There are other issues like awareness. For instance, in a rural community, even in 2019, there are people who are not aware that they can get transplants, even nephrologists. I think, though, that the executive order will increase awareness, will make it mandatory, and will reshift the payment in such a way so as to incentivize the referral of these kidney failure patients to be referred to transplant centers.
But also, the executive order increases the likelihood that someone would be offered the opportunity for home dialysis as opposing to going to a clinic. What kind of difference can that make in a patient's quality of life and daily productivity?
Yeah, so we're already seeing that now. So for instance, there are a number of patients, a minority, who have what's called peritoneal dialysis. And that allows that patient to have dialysis at home overnight while they're sleeping. And what it does is it makes life a lot easier for them. And it allows them, a large number of them, to go to work, actually. So they would work in the daytime, come home, and then have dialysis overnight.
I want to ask both of you what your thoughts were when you saw that the administration was focusing on this one particular disease, trying to make a difference, when the entire healthcare system is an extremely challenging thing to begin fixing, as we've all witnessed. But to look at one particular condition and say, here are some concrete things we can do. Susan, let me start with you. What was your reaction to that?
Oh, we were just so excited because 21 people die every day because they do not get an organ for transplant. So this is a crisis. This is a terrible crisis that we're dealing with.
Let me interrupt you there because I want to show some numbers. You talk about people who are on the waiting list and surgeries that are being done locally. So across the country, 113,000 people waiting for a transplant. The bulk of those, look at that, how high that number is, people waiting for kidneys. UPMC with almost 1,000 people waiting for an organ transplant. Allegheny Health, 400. Typical numbers? I mean, would these be the same in Cincinnati and in Baltimore and in Cleveland?
Yes, the numbers of patients waiting on the list for transplant has gone up for kidney transplants every year over the last 10 or 12 years. And it's going to continue to grow. And part of that has to do with the diabetes issue in the United States.
And Doc, talk about how much of a quality life a patient has when they get off of dialysis and they get transplanted, and how much better their life is. They can go back to work, they can just be so much more active.
I mean, people do some innovative things to try to get transplants. For kidneys, you see people going to Penguins games and holding up signs looking for donors. Some people will put signs in trucks and so forth saying they're looking for donors.
It seems like it shouldn't have to work that way, though. Right? That seems like a failure
yeah,
of the system.
But the truth is it's better than it was 10 years ago. So what's happening now is that I think patients are having they're able to have or comfortable with having a conversation on social network. Whereas I think 10 years ago, it was more discreet about donation. Because it is a big thing. I mean, you're asking a healthy person to donate a kidney. And so there's an amount of respect that has to come with that. The fact that we're able to discuss this now, I think, is healthy. And if you meet high school students, they're much more aware of organ donation now, which
That's right.
we're different.
Yeah, that's great. But just
Yeah.
the idea that my doctor might say, oh, here's what you need to do. You need to go to a major sporting event and hold up a
Right.
sign. Just seems like, well, no, there's got to be a better way. There's got to be a more sophisticated, scientific way of matching me up with a donor.
Well, do you find that millennials overall are more inclined to register than people of other generations?
Yes. Individuals in their 20s, we have some of the highest rates. Where we are challenged is males over 50, getting those individuals to register to be organ donors.
Why do you suppose that is?
I think because they're afraid of death. They don't want to admit that they're going to die, and by registering, they feel somehow that is admitting that you are going to die.
That's a psychological hurdle.
It is a cycle, and we are getting ready to launch a campaign to really deal with the male population and encouraging them to register to be a donor. And usually the males aren't making the choices in the family. It's usually the females that are making most of the healthcare choices.
Are there other states, other metropolitan areas that have a much higher rate of organ donation registration than we do? And if so, what's their secret?
Utah has one of the highest rates for registration, and their church, the Mormon Church, actively promotes that individuals should register to be a donor.
Interesting.
Well, what about kidney chains? How can kidney chains help? Or what about presumed consent? Laws presume consent.
Well, the kidney chains do help. And so what kidney chains do is if you have incompatible donors, you can begin a chain where one person can make the entire chain compatible, just to overly simplify it. And so for instance, if you could have 10 pairs that are not compatible for transplant, you could insert one person in there who's a donor. It starts the chain, and you do a swap so that you would then able to do 10 or 11 transplants. That's in a nutshell. Presumed consent, I think we're heading that way. I am in support of that, the opt-out option, but I'm not sure that that's happening.
It means you're a donor unless you specifically say, I'm not a donor.
Right.
Change,
That's right.
turn it around.
Yes. Yes.
An idea worth exploring.
I think it's worth exploring for sure. I just think Pennsylvania might be a little bit conservative and not quite ready for that, but I hope the future that might change.
All right, thank you both. We are out of time. When we come back, the Pittsburgh company playing a big role in America's planned return to the moon. We're talking with the CEO of Astrobotic next.